Hi, my name is Ashley Thompson. I'm going to be talking to you today about AAC devices. So an AAC device stands for augmentative and alternative communication. Augmentative in a sense that it's used to supplement existing speech. Alternative meaning used in place of speech that is absent or not functional. And according to ASHA, AAC is an area of clinical practice that addresses the needs of individuals with significant and complex communication disorders characterized by impairments in speech and language production and/or comprehension, including spoken and written modes of communication. That's kind of a mouthful, but basically what an AAC device is it's used to promote effective and efficient communication for both the user and everyone that they interact with. It uses a variety of techniques and tools such as pegboards, line drawing, speech-generated devices, tangible objects, manual signs, gestures, finger spelling to help an individual portray wants and needs, feelings, and ideas. So who can use an AAC device? Anyone can use an AAC device, toddlers to elderly. It's meant for people who have severe expressive communication disorders that typically display impairments in speech, language, reading, and writing, which we know are the four modalities. As I said earlier, anyone can use an AAC device. It just really depends on the individual and what their needs are. Traditionally, a toddler will need something completely different than someone who is elderly, and it all depends on their impairment and their diagnosis and the way that they communicated before. So someone who uses an AAC device, they may need temporary or permanent help. Every individual is different, and they fall into two categories: congenital disabilities and acquired. Congenital meaning that it's something they were born with, acquired meaning something that caused this communication barrier, so like a stroke or a traumatic brain injury, neurodegenerative diseases, things like that. And it's important to know that individuals with congenital disabilities are still acquiring language while they are using their AAC strategies, and AAC for individuals with acquired disabilities will vary and can change just like their disability can change as well. So AAC systems. An AAC system is defined as a group of components meant to enhance communication for an individual. AAC devices need to be made or programmed based on the individual's strengths and needs. So their communication needs to be both efficient and effective. Like I said earlier, that's our main goal as an SLP with these devices. And it's also really important that we build the AAC device based on their existing speech, gestures, languages spoken, etc. We need to make these devices comfortable and really aid in their communication. AAC devices can be aided or unaided. Unaided means they do not require an external tool. They do require some degree of motor control. So looking at this picture here, this red button, that's called a switch. That one requires a motor control, requires a child to press it. Aided forms require an external support. It can be electronic or non-electronic. And this is just a chart I pulled from ASHA that shows the different forms of AAC, unaided and aided, no tech, low tech, high tech, things like that, just to give you a visual. So other supports in the AAC setup. Some other supports include voice amplifiers, artificial phonation devices, vibratory systems, Morse code, and Braille. Now, when it comes to the hard of hearing and the deaf population, the use of hearing aids and hearing assistive technology systems, those are not AAC, but they are assistive technology, and they still aid in efficient and effective communication. Symbols used in AAC represent objects, actions, concepts, emotions. They can be drawings, photographs, objects, facial expressions, gestures, auditory systems, orthography. But the bottom line is that it needs to be individualized for who it's set up for, and it also needs to be able to relay the message they are trying to send in the best way possible. It would not make much sense that an AAC device isn't getting the message across that it needs to. So setup continued. We also need to think about the display of the AAC device. It needs to be efficient and effective. I know I keep saying these words, but it's so important. It's Pretty important that the display is modified depending on what the individual needs. So maybe a child who's younger or lower functioning may not need as much on their board as, say, an elderly person who has had years and years of language. But like I said, it all depends on the individual and what they need. The display can be static, dynamic, or hybrid. So static meaning that it doesn't move, so that'd be like a pegboard or like a piece of paper with some different messages written on it. Dynamic is going to be more of like an AAC, or a iPad that moves, the screen changes, things like that, and a hybrid is going to be a mixture of both. So the different display types, there's going to be static, dynamic, hybrid, like I said earlier, and then this is just another visual that I pulled from ASHA that just breaks it down into more of a chart form. And then the role of the SLP with AAC. So SLPs play a large role in all aspects of AAC devices. We are actually the ones in charge of programming an AAC device in the schools, so we need to make sure that we are programming them the best way possible. We talk to other professionals, we train parents and other caregivers on how to use the devices, we document their progress with it, we decide which AAC device will be most beneficial for our patient, we participate in the IE meetings of individuals with an AAC device, we ensure their goals are being met, they're being used properly, we maintain research on AAC devices so our patients are always given the best devices possible. We have a lot of responsibility when it comes to AAC devices. And then this is a video that I pulled up from YouTube. It shows a nonverbal child with autism using his AAC device to communicate with who I believe is his mother on the different types of vehicles that are driving by. And I think it's just a really good visual to show how AAC can also enable learning as well.
SUV. Pickup truck.
Yeah, buddy, that was a pickup truck.
SUV. Pickup truck.
Good job, bud. What's it gonna be, buddy?
SUV.
Yeah, it was an SUV. Look, what's that? I'm recording you. Go ahead, put it on. There it goes. What is it? What was it?
SUV. SUV.
Good job, baby.